Well, it's time for another edition of Dangerous Dinosaur. I started a series based on my hospitalization and what I learned from them. If you recall, I was hospitalized 4 times with various lungs and viral infections since Christmas. The first time that I went to the hospital, I had RSV virus plus pneumonia. After a little more than a week, I was released and ostensibly cured of RSV and pneumonia. I went to see my primary care doctor after the weekend, and he said I seemed to be okay, but they decided to take an x-ray just to make sure. And he said I would give me a few antibiotics as a prophylaxis measure. And then, if I didn't feel any better and got worse, I should go check back into the hospital in the emergency room. Well, day after day, things got less and less comfortable, and I felt worse and worse. And finally, after 5 days, between Monday and Friday, I felt like hell. I had a very difficult time breathing, and I was also notified by the doctor that the x-ray showed that my pneumonia might not have been cured and I might still have a touch of it. So that's why they had the prophylactic, I think it was doxycycline that they gave me. Anyway, the night of a blizzard in Boulder, I decided to go to the emergency room because I can't breathe. And I go to the emergency room, and I'm sitting there, I'm the only person there, and I go to check in the emergency room, and I ask if I could have some oxygen because I was really in distress. And the check-in person there said, well, you should have brought some from home. Well, that's all I could do to think of getting into the car, coming from home and going to the hospital, and worried about getting some relief from my breathing. In any event, the attitude of the woman there, it sort of pissed me off. It seemed to me that it was more important that she fill out her form for admittance to the emergency room than whether or not I lived or died. I felt like I was dying for lack of oxygen. My oximeter showed that my oxygen level was about 65, which is quite low. I had to wear a mask because mask rules were in effect in the hospital, which lowered my level even a little more. So I sat there and waited for the oxygen. Finally, I turned my wheelchair around and went outside and said I was going to go home and get my oxygen if that made it feel better. Since my home was only about 8 blocks away, but it was cold out and I didn't have a coat on. It was blizzarding. So finally, when the nurses came outside, I was trying to call a lift outside in the blizzard, and he asked me what I was doing, and I said, well, I was going to go home and get my oxygen because the woman in there at the desk seemed it was important that I have it in order to breathe. Well, it sort of dawned upon him that I was pissed off that I couldn't have oxygen, that they didn't want to give me oxygen, and the job of the front desk wasn't to provide for the patients, but it was more important that the proper forms be filled in correctly. And I couldn't help but think of Max Weber's admonition of how a society deteriorates when form starts taking precedent over substance. And the substance was I had signs and some initial diagnosis of pneumonia. I'd been in the hospital a week before with pneumonia and released, and very likely I could have been released still having the pneumonia. And in the meantime, I was having difficulty breathing, and I needed some sort of treatment. Well, anyway, the nurse was very knowledgeable outside and said since it was blizzarding and the lift hadn't come yet, that they were going to make me go inside one way or the other, and that if I didn't go inside because having a fever and things like that, my prior chart, that I was a danger either to myself or whatever. So finally they prevailed. They hooked me up with the oxygen. I go in. Well, there was a car accident, and it was a fatality. So people in the emergency room were sort of tied up, and I sat and sat and sat there. Finally, they gave me a bed. It was about 10:30 at night, and I was readmitted to the hospital. And instead of having the RSV virus, this time, in addition to the pneumonia I already had, I had COVID-19. So I had to go back into the isolation room where they had to dress up in moon suits, etc., in order to visit me and give me my medication and take my vital signs and things like this, which is a real pain in the ass for everyone, because they put on a separate costume, separate mask, separate gown, etc. And then to go outside, they had to take the gown off inside the room and go outside. And if they had to come back in, they had to put another gown and mask back on, which took time, which also interfered with the efficiency and the efficacy of the treatment, because particularly if you're a lung patient and have trouble breathing, the time that it takes to get the suit on can throw somebody in a real panic. And if you have things like COVID-19 or RSV, particularly in conjunction with COPD, all of a sudden, if you can't breathe or have trouble breathing or difficulty breathing, you feel like you're drowning. And an extra minute while they're gowning up seems like an eternity. So I wasn't too happy that I came back with the same virus a week later, and that I caught another virus. I came back with the same pneumonia. So I had pneumonia instead of pneumonia plus RSV, I had pneumonia plus COVID-19. So back to the ward and back to the problems and back to the computer ran system in the hospital. Now I checked into the hospital, I think at about 3:30 in the afternoon, and then the accident occurred. It was a Friday night. Finally I got to my room about 11:30, and of course I was very hungry. I don't have lunch often, so I hadn't eaten since that morning, where I had a Danish and some coffee, plus my medicine. Now I'm on 14 pills every day, so the medicine is, quite a bit, and it's quite a bit to take on an empty stomach. And to continue on the empty stomach all day is very, very hard to do. And as sick as I was, you got to remember that a lot of people were put on ventilators with COVID. And although I'd had 4 COVID shots, apparently it wasn't quite enough. And I guess I'd been exposed a little longer than what they thought, because the test for COVID said I was too late to get the whatever it is they give you to lessen the effect of the COVID. And I'd had the disease a little bit more than what they used, or the standard they used in order to give you the anti-COVID serum or whatever the hell it is. So here I am in a hospital again. I was released early. I wasn't too happy about it. I couldn't breathe. I had a real difficult breathing. I was psychologically destroyed in a lot of ways. I was angry, I was pissed off. I was angry that they wouldn't admit me to the hospital right away, and they were mad at me for not bringing my oxygen from home, which inconvenienced them, setting me up with oxygen in the chair and all of this other stuff. I was also pissed off that the COVID test was positive. I was pissed off that I had to go to the emergency ward, and I was pissed off that I hadn't eaten all day. And I was extremely annoyed and panicked because they wouldn't give me any medication. And one of the things that I learned to rely on, became very dependent on, was albuterol, which people with COVID-19 or people with COPD use quite a bit. And I used to use it rather sparingly, but they give you nebulizers, and it comes in a canister thing, and the canister thing is called a rescue inhaler. And when your lungs get really bad, you start panicking, you feel you can't breathe, and you feel you're going to die, you take the rescue inhaler and you give yourself a puff of albuterol, and it relieves it enough so at least you don't think you're dying and you get out of your panic mode. So here I am in the emergency room for the second time that month, and the medication hasn't arrived, although I've been there for quite some time. I think I'd been there at that time like 8 hours, and there had been no orders for food, and the doctors have to give orders for the nurses to do anything. So there weren't any orders for any medication, there weren't any orders for any food. And I had really a hard time, difficult time breathing. And I asked for an inhaler. Well, they wouldn't give me an inhaler because they didn't have orders for it. And I'm sitting there panicking because I couldn't get an inhaler. Well, I did have one in my pockets and I used it. Now, what they do is if they catch you with an inhaler, then they take it away from you because their orders are that you can't have any of your own medications without it being inventory and checked in and things like this. Well, it did alleviate enough for me to get the doctor's orders, and they did give me I think it was a turkey sandwich or something like that, so I wasn't totally starving. They came in and took my blood sugar, and they drew blood, and they did all the vital signs bullshit stuff, and started me on an IV antibiotic. Well, a little while later, I said I wanted a nebulizer treatment or something because I was having more difficult breathing. Well, the respiratory therapist came in and said I couldn't have one for 6 hours, which was ironic. Here I am with COPD. It's a lung disease. I used to watch on television and saw the statistic of people dying from having the COVID-19, how they were on ventilators, and here I couldn't have an inhaler or a lung treatment to help me breathe for 6 hours, which I thought was ridiculous. So in my questioning and interrogation of why 6 hours, I am told that's what the data in the computer says that you're supposed to give this. Well, I've done some FDA work. I've had litigation against the FDA. I was chairman of a medical company, actually of 3 or 4 medical companies where we had dealings with the FDA, and I know all about labeling. I had litigation with labeling. And ironically enough, as of Thanksgiving, I started working on a project with a friend of mine who was head of one of the leaders of artificial intelligence at Carnegie Mellon. And we were working on artificial intelligence, about how artificial intelligence would affect the law, lawyers, and things like this. So it was ironic that I was working on that project at the time of both hospitalizations. So I'm reflecting on that. And I know how the models work in the hospital. It's all mechanized. Everything goes into a computer. So you check into the hospital, the doctor has a check sheet. Hey, check this, that, and the other. And one of the check sheets are the orders. And you could have a cardiac diet, a regular diet, a diabetic diet, any kind of combinations, but it's a check mark thing. And it goes to the food people. So one time I was there, I had a regular diet until I had a heart cardioscope thing, and then for some reason, since there was a cardiologist, they turned me to a cardiac diet, and it took me 2 days to get changed back to a regular diet because it went into the computer system as a cardiac diet, and nobody would enter the computer system and correct the error. I had to fight with them for 2 days. In fact, I had to threaten to go on strike unless they changed it. Well, this time it was the albuterol. Now, there is nothing worse than panicking when you have a lung disease. You think you're drowning. You lose all rationality, all sense of reality. All you know is you're dying. And that's what goes through your mind when you can't breathe. And here it was. I wanted the albuterol so I could breathe. I couldn't even talk. I was panicked. And they wouldn't give it to me, and they said I had to wait 3 more hours to get the treatment because that's what the computer said when the computer said I could have it. Because the diagrams, or excuse me, the directions on the labeling of the nebulizer and the albuterol was take every 6 hours. Now, it's ironic because you send people to nursing school, to medical school, to make decisions. You don't send them to abdicate their decision-making power to a computer. But that is exactly what was going on at Boulder Community Hospital. The computer said every 6 hours, the technician and nurses came in and said it's been 3 hours since you had your albuterol, therefore you got to wait 3 hours. Unless, of course, you go and pass out, then you got to be put on the ventilator. But until the ventilator is necessary, you have to wait and suffer. Now, a lot of us took oaths, and not any of us that are professionals ever recall taking an oath where you let your client, patient, customer, etc. suffer until you follow the instructions on a label that some bureaucrat made up. But that's exactly the position they put me in. So they came in and I said, look at your chart, read your chart. What does it say in the chart? When am I supposed to have this? Because when I was in the hospital a week ago, we went all through the logic of the albuterol, the inhaler, the rescue inhaler, when I had the RSV. Now, my position is having the same pneumonia and also having COVID-19, which was much more serious than the RSV virus. They should pay more attention. And it was in the prior hospital chart that I had the albuterol as I needed it, and it was clearly marked on it. But if you look at the forms that the hospital used, every time you're admitted, they have a questionnaire, and they don't refer back to the previous admittance. So the forms on that questionnaire were the same typical artificial intelligence question and answers on medication and when the medications are to be given, how often they're to be given, and the dosages. So all of the medications were listed. They were scanned into the computer. The instructions were scanned into the computer. All of the data, the dosages, the frequency, etc., were scanned into the computer. So it was automated. And this is what they used to make decisions on treatments. Now, I don't know about the rest of you, but I am not particularly happy that some dumbass computer is going to make treatment decisions on me. Particularly when you tell the people to look at the chart and you know that it was in the chart a week prior, the various changes were in the chart a week prior. But apparently nobody told the next group of nurses to look at the previous hospitalization chart. So when I said look at the chart, it didn't dawn on anybody to look at a previous hospitalization and look at how problems were resolved. I assumed they were doing this. So I became more and more angry that the stuff that I had gone through in the prior hospitalization was being ignored. I was being denied my medication, and I was starting to lose my temper. So for some reason, the young nurses couldn't understand why an 80-year-old man who couldn't breathe, thought he was dying, and in a panic, became uncomfortable and maybe a little bit angry. So this caused friction between the nurses and the hospital staff and myself, because I assumed they were deliberately ignoring me. I assumed they weren't reading the chart, which was wrong. What I should have assumed is I should have said, read the chart on my prior hospitalization. Because even though I'd only been there a week prior, most of them didn't know that I'd been there a week prior because of the shifts and various things like that. Some of them remembered that I'd be from the last time, but they didn't put two and two together. Now, this is not a very encouraging thing for prospective patients, particularly when there's this big thing with artificial intelligence to take over. Well, you got to conclude a few things. First off, it's not artificial intelligence. It's computer-aided decision-making. But you can't rely on the computer because the computer programming isn't perfected. And that's why they make people train. There's some indication now that briefs have been written by artificial intelligence. I've used artificial intelligence on sophisticated legal problems in the course of my research. One of the problems I did was the Second Amendment. And the research I did on the Second Amendment for several hours was absolute bullshit. They didn't come up with any conclusions. They came up with suppositions with facts not into evidence used to make the decisions. So if you have a label on albuterol, for instance, and it says administer every 6 hours, and the person doesn't understand or remember or realize that this is some sort of a guideline, and that the purpose of albuterol is to help somebody breathe, and the puffer, the inhaler, is called an emergency puffer, and that it's to be used in cases of emergencies, and emergencies don't occur every 6 hours, that there ought to be some sort of exception. Now, I would think, having taught at all levels, particularly the university level and also the postdoctoral or postgraduate level, that you would think and learn various things from professional training. For instance, there's a code at law saying, when I was in law school, you objected to evidence on the basis it was immaterial, irrelevant, or incompetent. Now they have a code that if it's this, that, the other, it's this. If it's this, that, or the other, it's that, etc. They don't label it those three things, but they say it's a 607 violation or a 620 violation or 630 violation, and everybody's supposed to know what the numbers are, then you could be initiated. But essentially it's incompetent, irrelevant, or immaterial. Now, we are taught to determine what immaterial means, if it's material to the question, or we were done that. Now they memorize a bunch of rules. The problem with rules that are written down is it doesn't allow for interpretation. Common law allows for interpretation. So that is one of the problems with artificial intelligence with law, because artificial intelligence, the way it is now, is a large language model. It's not sentience. They just pump more and more language in there, more and more books, more and more data, but it's still the same technique to ferret out the data. And if the data is incomplete or incorrect, there's no way of correcting it. And you have to look at the result of what the question is in order to know whether or not it's valid, because it could be way out in left field, and if you don't have the requisite knowledge in the first place, it's not going to help you. So with the albuterol, you have to know what it's for. You have to know why it's administered. It's administered to make breathing easier with people that have breathing problems. Now, statistically, maybe it makes breathing earlier for the gross majority of patients if you administer it every 6 hours. That's on a maintenance basis. But if they got something wrong, if they got a disease or they got some sort of problem, every 6 hours won't cut it. So you're trained to recognize the fact that the patient is in distress and maybe needs the albuterol earlier. This is what I was trying to convey to these nurses. And for me, it was very frustrating that they couldn't see that, or they had to ask the doctor if it was okay to administer it beforehand. Well, doctors go home, doctors go to sleep, doctors don't always answer their page, or they have other patients they're seeing. So if you've got a patient that's in a panic, thinks he's dying, and you have to wait for the doctor to finish other patients, it can really distress a patient, and it can harm a patient. They can have all kinds of bad thoughts clear up, and including suicide. So it's a very serious thing, and the nurses should be trained to recognize this. I didn't know that they were or not. Anyway, finally I get released with the COVID. I had a lot of arguments back and forth with the staff until finally they did go to the previous hospitalization and figure out that I could have it as needed. And in fact, they went into the programming and into the computer and went past the computer instructions and showed or saw where somebody had made an addendum that it said also I could take when needed. QED, I think, was the thing there. But anyway, that's how my second hospitalization went, and it was purely hell, and it was rife with conflict with the staff. And the conflict occurred because they didn't use common sense. The conflict occurred because they worshiped the computer, and they thought their jobs had to do with computer and had to do with computer rules. So we need to take a look at that and look at the dangers of that when and if we go to computer models and computer-aided design or computer-aided decision making, because it's not going to replace thought-induced thought-motivated decision making. And we should be looking at that. There is no reason that somebody with lung distress and lung problems suffering from a viral infection should have a computer rule whether or not he is eligible or can use a medication, when it's clearly the purpose of the medication to either relieve or lessen stress or suffering. So think about that, because the next hospitalization is even worse, because I have a third virus and I'm back in the hospital a week later with the pneumonia cured, but the third virus. And I have more on this subject of artificial intelligence and computer-aided decision making. Thank you for watching, and please like my channel and tell other people about it and subscribe. Thank you.